us just cringe at the thought of being awake while under the knife.
But for some, it's an appealing idea when it comes to cosmetic procedures. Tonight, we take a look at the pros and cons of awake surgery and how it could impact your life. 2 years ago, 36-year-old Lisa Benton had breast augmentation surgery. The South Charlotte mom of two is considering other procedures also, but has no plans to try out awake surgery.
There's no way that I would want to have plastic surgery awake.
Other women are interested in the technique. Instead of using general anesthesia for surgeries like breast augmentation, liposuction, or abdominoplasty, or tummy tucks, doctors use large doses of local anesthesia. They say it offers the patient more control, even lets them provide input on shape or size, and saves them money, too.
If you do surgery under local anesthetics, you don't have to employ an anesthesiologist. So there's one fee that you wouldn't have to pay if you were the patient.
Dr. Marco Pelosi III is an OBGYN in New Jersey. He also performs cosmetic surgery and does 4 to 5 awake lipo procedures a week. He uses the awake technique for other surgeries, too, like breast revisions and tummy tucks that only involve skin tightening, not muscle. He says more and more women are requesting the technique, but that it requires the right candidate.
People who are poor candidates for this type of surgery are people that have a low pain threshold or that are extremely anxious about the procedure, or they may have a medical condition.
Safety should be first and patient comfort should be second. And if being awake doesn't provide safety or comfort for the patient, then it's at a loss.
Dr. Stephan Finical is certified by the American Board of Plastic Surgery. He says awake surgery is driven by doctors who don't have legitimate certifications in the field of plastic surgery, not by patient empowerment.
In truth, anybody who's somewhat sedated is not in any position to make judgment.
Finical says large doses of local anesthesia can be toxic and warns women about the lower cost, too.
It may be cheaper, but the cost is on the other side. The cost is on your result, and the cost is on future surgeries. The cost is on potential pain, problems, health issues that money can't buy.
Benton can't imagine being awake during her surgery. And as for the lower price tag, she says you get what you pay for.
I think it's just people trying to bargain shop for a procedure that they should not bargain shop for.
I tweeted about this report and heard from a woman who prefers to be awake during her lipo. She says she's had it done 3 times and she is considering a 4th go-round. She says if she panics during the procedure, her doctor calms her down with breathing exercises.